Well, good afternoon. It's been another exciting day of science at the annual American Heart Association annual scientific sessions in New Orleans today. I'm Dr. Kevin Campbell, and I'm a contributor for MD Magazine. Today at the AHA meetings, several late-breaking clinical trials were presented. One trial in particular really stood out to me as a potential game changer. Dr. Mike Gibson and his colleagues presented the Pioneer AF PCI trial. In this trial, the question was asked how to best manage anticoagulation in patients with atrial fibrillation undergoing PCI. Many of these patients require so-called triple therapy with aspirin, Plavix, and warfarin in the past. This study tried to see if we could get rid of the aspirin or substitute a NOAC, such as Xarelto, or a combination of each of these. There's been much concern about bleeding in these populations. In this particular study, patients were randomized to receive either Xarelto and Plavix, or dual antiplatelet therapy, or warfarin and dual antiplatelet therapy. The Xarelto dose was lower at 15 milligrams a day for the patients that received Plavix and Xarelto, and for those that received dual antiplatelet therapy, it was a baby dose of Xarelto at 2.5 milligrams BID. The results found that patients who were treated with Xarelto instead of Coumadin at the time of PCI for AF were found to have a statistically significant lower rate of bleeding complications. In addition, the rates of all-cause death and hospitalization were lower in the Xarelto groups. The cardiovascular death, MI, stroke rates in both groups were absolutely comparable. It's important to note, again, there were much different doses in the Xarelto group. If it was just Xarelto plus Plavix or other inhibitor of that sort, the Xarelto was 15 milligrams a day. If it was dual antiplatelet therapy, the Xarelto dose was 2.5 BID. So, what does this trial really mean to us as practicing cardiologists? Well, first of all, I think it's important to remember that in this trial, the number needed to show benefit was 11. This is the most stunning data, in my opinion, that has been presented thus far at the AHA this year. I think it really tells us that it's safe to use Xarelto and PCI in patients with atrial fibrillation, and this ultimately may be a better strategy in these patients that are going to require so-called triple therapy in the past. Our objective is always to give maximum benefit with less risk, and bleeding is a significant concern in this particular subset of patients. I think this study does have the potential to change practice. I personally think that this is going to be a very impactful trial as we move forward from the AHA scientific sessions. I would now probably suggest to my colleagues, if we're treating patients with atrial fibrillation who are undergoing PCI and are at risk for bleeding, that we use low-dose Xarelto and Plavix in order to minimize complications. Bottom line, I think you give 15 milligrams of Xarelto with Plavix or similar, or you give 2.5 milligrams of BID of Xarelto with aspirin and Plavix in these patients in order to maximize benefit and minimize risk. I'm looking forward to another fantastic day of science at the American Heart Association. For now, I'm Dr. Kevin Campbell, contributor to MD Magazine. I'll be back tomorrow with the latest and greatest news from AHA 2016. Thanks so much for watching, and we'll talk to you then.